Thank you, Mr. Chairman. Thank you to the witnesses for being here today. Without any question, we look forward to hearing your testimony. For many of our nation's seniors and people with disabilities, accessing federal resources and services has been too big of a problem that must be solved. This is especially true for our veterans, and that's why Senator Casey and I are working to solve problems with a variety of solutions. And I thank you, Mr. Chairman, for your participation in so many of the efforts to include working with the VA and to improve the website accessibility for disabled veterans and disabled VA employees. We also requested the DOJ comply with reporting requirements regarding improved website accessibility for Americans with disabilities. In May, I hosted an event to honor our active duty, reserve, and National Guard military personnel, defense contractors, and those who fought in Afghanistan and Iraq. We had nearly 700 attendees at home in Charleston, South Carolina. It was a wonderful event. It's a wonderful way for us to acknowledge the incredible sacrifice, and those who serve our country should be honored on a consistent basis. I would like to acknowledge our South Carolina service members, veterans, and those currently stationed at military bases throughout this nation. 1 out of 4 of our veterans have a disability that is consistent with their military service, and the median age of our veterans is around the age of 65. Tony Green is a veteran from Charleston, South Carolina, who served in the Navy for 8 years. Following his military career, he had trouble assimilating into civilian life and started suffering severe bouts of depression. He went from living in the comfort of his own home to living in a homeless shelter. Determined to change his life, he reached out to the VA and received treatment for his bipolar disorder. The VA and its telehealth services, which he accesses from his phone and laptop to receive care and manage his medication, have made all the difference in the world for Tony. He took advantage of the VA's comprehensive work therapy program that led him to a job with the Palmetto Goodwill's Ability One program. He went from a food service worker to cook to supervisor. Tony is now an assistant project manager in downtown Charleston. He is also the first homeowner in his family. Telehealth became a godsend for millions of Americans like Tony, especially our seniors during COVID-19. Patients connected with their doctors even when they were isolated. From March of 2020 through February of 2021, more than 28 million Medicare beneficiaries used telehealth services. Donna Avant, named the 2021 Pharmacist of the Year, has been providing telehealth education free of charge to the residents of Bamberg County, South Carolina, since 2020. In this rural community, where the nearest doctor is 12 miles away, the nearest emergency room is a half an hour away, and more than 100 seniors received free tablets for health screenings and chronic disease education, such as diabetes and hypertension. Seniors use Zoom and the phone. It improved access to healthcare, to doctors and specialists that they otherwise might not be able to see. South Carolina is a leader in the telehealth innovation. The Medical University of South Carolina has one of just 2 federally recognized telehealth centers of excellence in the nation. In 2021, I introduced the Telehealth Modernization Act with Senator Schatz and a bipartisan group, including Senators Collins and Warnock, which makes telehealth flexibilities permanent even after this pandemic is completely done. Without congressional action, however, these emergency provisions will end, and they will end soon, like in mid-October of this year. For the tens of millions of Medicare beneficiaries and others who rely on telehealth services, that would be tragic. Federal regulations have not kept up with the technological advancements that we've seen in this country. We must keep telehealth available and accessible for all Americans, including our seniors, our military heroes, and disabled individuals, so that they can take care of themselves and meet the needs that they have. I look forward to learning from today's witnesses Thank you, Mr. Chairman. I yield back.